Daniel raised more than $400 million. What is the opportunity to grow now? What is the size of the market that you can now penetrate?
Well, thanks for having me, first of all. Our vision at Hinge Health, is to use technology to scale and automate the delivery of care itself, and that is a fantastic opportunity. We've started with physical therapy, so we've shown that we could automate away about 95% of human clinician hours associated with physical therapy, which is about a $50 billion market here in the US, and 20 million Americans now have access to Hinge Health out of about 260 million adults in the US, only about 8% of adults now, across 2,300 customers, and yeah, we're just getting started.
Just getting started. You come in at a healthy more than $2 billion valuation at the price point that you priced at. But that's actually a long way from your original valuation back in 2021, when markets were a little more crazed, shall we say. Why come to IPO now? Why not wait for valuation to recover? Will you ever get to the $6 billion level again, Dan?
Well, look. When we closed our last private market valuation in October of 2021, it was 3 weeks before the NASDAQ peaked in that last bubble. It wasn't because of some, genius stroke on my end. It was divine intervention. But, I'll tell you what, since that moment, we have more than quintupled our revenue, doubled our gross profit, so 10x our absolute gross profit that we're bringing home. We went from losing $100 million a year to being free cash flow positive for the last 4 quarters and having a 12% operating margin in Q1. And so look, I can't control where the markets are going to go, but I can say that we held up to our end of the bargain.
Daniel, I've had hundreds of hours of physical therapy and physio, and I've left my rugby career behind. But I went and did that in person, physically. This technology convinced me that it's going to get a whole market of people that are reluctant to go and do that because they can suddenly do it through a digital medium.
Well, look, you're not alone. About 40% of Americans will have a musculoskeletal condition any given year. That ranges from like a sprained ankle through a twisted knee through, say knee or hip arthritis through just, chronic low back pain. And so 40% of us have a musculoskeletal condition in any given year. About 9% of us see a physical therapist. So there's a big drop off between those with the musculoskeletal conditions and those actually going to PT. And that's not because people dislike PTs. PTs are one of the most popular providers in the healthcare industry. But going to PT, taking 2 to 3 days off work, each week, paying a copay, paying a parking fee, which is kind of the hidden copay in America's healthcare system. It's really inconvenient, and so what we've done with our technology is to improve access, improve convenience, improve personalization, and substantially lower costs, and that's why we've been so popular with members and with our enterprise customers.
The biggest complaint and problem for you growing the top line as well about virtual health is the insurance factor. Have you cracked it? Will you be able to move smoothly billing through insurance, that kind of thing?
Well, you're absolutely right. Reimbursement or getting through insurance is one of the biggest barriers to innovation in healthcare. And so we're lucky 50 plus health plans and pharmacy benefit managers, including 5 of the top 5 health plans and all 3 of the leading PBMs, have selected Hinge Health as either their preferred or exclusive digital musculoskeletal provider. And this means self-insured employers who are buying us don't have to worry about contracting, IT security, procurement. They could turn us on a lot easier. So look, it was really tough early on, but we've shown a repeatable go-to-market motion to where we could onboard a lot of customers very, very quickly. And now 20 million Americans have access to Hinge Health. But we've got a lot of work to do because there's 120 million Americans get their health care from their employer and another 100 million plus who are on fully insured Medicare Advantage or federal plans. So we've got a lot of work ahead, but we have a really good head start and a repeatable motion.